Hello, everyone. We're here for our next breakout session. This is the psychological impact of cancer. My name is Emily Steen, and I'm the Childhood Cancer Survivorship Program nurse. I'll be moderating this session for today, and before I introduce our speaker, Dr. Litak, I do have a few ground rules to go through with you. The goal of the session is to help you feel better, more hopeful, and not so alone. We'll not talk about specific diagnoses or treatments or give medical advice, and there won't be specific discussions around side effect management. If you're joining us online today, our virtual moderator is Sharon Hui, and she's monitoring the chat, so please feel free to comment anytime throughout the discussion with questions that you might have. We will have time, about 5 minutes at the end today, or 10 minutes, for a Q&A session where you can raise your hand and ask questions. I'll come around the room with a microphone. I'd like to introduce our wonderful speaker today, Dr. Litak. Dr. Litak is a board-certified child, adolescent, and adult psychiatrist. She's been actively involved in medical education and teaching as a chief resident throughout Minnesota. Dr. Litak has worked with diverse populations, including children in the welfare and juvenile systems, young adults and adolescents with substance abuse, and enjoys working with a multidisciplinary team to provide patients with the most comprehensive care. Welcome, Dr. Litak.
Thank you so much. Thank you for having me, and it's an honor to speak to you today. I'm a child and adolescent psychiatrist by trade, and most of my practice happens at the Masonic Children's Hospital, and I am the medical director for child inpatient psychiatry units. So that's what I do lately, and I teach a lot of residents, and I work with multiple teams. I have to apologize for the title of my talk. I thought my talk was to talk to families of families and parents of kids with who have been diagnosed with cancer, but I don't think I missed about that much because we're going to talk about the family systems. So whatever I talk about children or families, this is applicable to the family system as a whole. So some of the slides have pictures of little people holding hands and teenagers, so apologize for that. I think I misunderstood the talk, but it's still going to be relevant. So when we think about cancer, we think about all the medical treatments that are involved, all the procedures that happen during treatment, the many months of treatments. I think that what's not spoken enough about is the psychological impact, and it's really not only our physical bodies that are dealing with the diagnosis and treatment, but it's also our minds that have to deal with it. And all the aspects of treatment. It's not a race, it's a marathon, and it's, how many of us are ready for a marathon today? Nobody is. People usually train for marathons, and for cancer, it happens, we know when we have the diagnosis, it happens unexpectedly, and nobody has really trained for that. So when people get diagnosed with cancer, it impacts the entire family. It's not only the person that gets diagnosed, they are impacted, but also the family gets impacted. There's a lot of uncertainty, a lot of questions, and it's hard to wrap your head around what's going to happen. It's difficult to predict, and the treatment is usually fairly long, and the person who has the diagnosis and their family are really entering a new realm of the uncertain future. Along with the treatments, there's going to be a lot of physical and emotional challenges that, in addition to your physical challenges, the emotional challenge is going to be as difficult, and sometimes the psychological challenges will complicate the physical treatments. This presentation focuses most on post-traumatic stress symptoms. It's important to know that if somebody has post-traumatic stress symptoms, and we'll talk about it a little later, it doesn't mean you have post-traumatic stress disorder. So having some post-traumatic stress symptoms can happen, but it doesn't mean you have the disorder. You may have some symptoms, but you don't have the whole diagnosis. One of the other symptoms of distress and exposure to trauma, diagnosis with cancer is not easy to deal with, is also depression. And that's probably more common. We will talk about how to support yourself and how to support your loved ones when they get diagnosed, when they receive the diagnosis, and any other traumatic events for that matter. So, what is trauma? This term has been used very commonly. You may see a lot of publications recently talking about trauma this, trauma that. It's important to emphasize that trauma is a significantly and highly distressing event that overwhelms the coping capabilities of an individual. So and the diagnosis of cancer can be as such. It's not an easy thing to hear, and you may understand it on the psychological level, but you may not understand it on an emotional level, and it's hard to predict how you're going to be affected by it. And when you go through treatment, it's not easy. And you will have to deal with procedures. The initial diagnosis is difficult, and you don't know what it is, what it means to you. You may consult Dr. Google. Lots of people do. This can be, it's healthy to some extent. It helps you understand the diagnosis and prognosis and treatment, but consulting Dr. Google compulsively, it's probably not helpful. Some people consult Reddit. There's a wealth of advice on Reddit about various treatments, cancer treatments including. So, what can be traumatic in cancer treatment and dealing with cancer is the diagnosis itself. How do you deal with this fact that now you know that the doctors think that's what you have to do, and how it's going to affect your life, your future, your relationships, and about everything about you. And how you're going to respond to it is really very difficult to predict. We think we are resilient. We're not resilient 100% of the time. And resilience is actually something that comes and goes. It's normal. We think we are super resilient. Most of the time, no. Actually, and it's okay. It's good to give yourself grace with that. There is a fear of unknown. What's going to happen when with this diagnosis? How is the treatment going to pan out for you or your loved ones? There is a lot of unknowns. Well, the study shows one of whatever happens to them, but what it means to you, hard to tell. In treatment, oftentimes there's many invasive procedures that are involved. There's surgeries, biopsies, getting an IV, or the access to your circulatory symptoms. That's all traumatic. Like we kind of have this cover, and most people really don't want to know what's inside, like here. The treatments also can be painful. And pain actually increases the risk of trauma response for cancer treatment and for anything in life. If we are in a lot of pain, physical pain, that increases our risk for trauma response. If we feel that isolated from the family, and how we cope, like an individual who is diagnosed with cancer, how we cope with it may be different than how our families cope, and how they cope it's also important and it affects our recovery. So the focus was, the focus of my talk before I came here was to talk about the family response. It affects the adults. I mean, we like in the breakout session after my previous talk, somebody said, well, we're all children. I mean, when you think about kids and adults, we are all part of a large family and we need support. And it's as important to acknowledge as if you're a caretaker of a person who has been diagnosed with cancer, that you also have to deal with it, and how you cope with it is going to make it, change it for them, how they deal with it as well. You know, when you are, and you know, even sometimes when you are in a group, and you know, like when you're in a hospital, and you know, many times people sit in a hospital with you. It's possible to be surrounded by your family and feel very alone at the same time. And you know, and then with cancer, you know, there's always a fear of recurrence and death and what's going to happen, and those are not, you know, most of us don't think about death. That's not something that we think, and that really faces, you know, that diagnosis. You know, you have to face your own mortality, and you don't know the timeline, and uncertainty is very difficult. And it's important to remember, in my slide, is that each child deals with this experience, and their reactions are very unique to them, and the same applies for adults. As many people we have in this room, each and every one of us is going to react with this diagnosis and treatment in a different way. And for some people, their reaction and response may be immediate, and for some people, and maybe, you know, at some point during treatments are usually very long. It can be after the treatment is completed, or it can be a year later. It's really hard to predict. So what are the post-traumatic symptoms? And again, I'm not talking about the disorder. This is for children, but it's also for adults. They're the same. So when the people deal with stress, they may have a number of reactions. They don't have to have all of these reactions. They can have some of these reactions. Again, I would like to emphasize that having a post-traumatic stress disorder, it's a really defined set of cluster of symptoms, and you have to meet certain criteria. And it's the way the simplest way I'd like to describe it is like when you have these symptoms, but they go into an overdrive. It's like that's really what's on your mind, and you really can't move on. So some of the clusters of symptoms would be the reliving of the events, you know, thinking about your diagnosis, thinking about treatments, thinking about the procedures you have. And you can get intrusive thoughts during the day, like you're there again, or that you just kind of keep thinking about it all the time. Or you can have nightmares about it. People may start avoiding places. You know, I really don't want to go here. I have a friend of mine who had cancer, and Park Avenue is not where we drive if we go together. She gets very, just not where we go. You know, people may, because people may be reminded, you know, even after your treatment is completed, people may be reminded of what happened there, or just the diagnosis itself, or the treatment. And, you know, you really, you know, reminders are difficult. And people may avoid talking about it at all, too. People may start feeling guilty. You know, what did I do to deserve this? You know, I should have exercised. You know, we always should have exercised more. We should have eaten better. We should have, you know, went for walks more often. You know, we should have relaxed, and we should have not drink whatever we were drinking, you know, including Coca-Cola, or, you know, maybe less sugar, whatever we were doing. Well, we should have done better. We knew better than that. Well, you know, those are not helpful thoughts. People may start forgetting about what happened, during treatments. People may start feeling kind of disconnected. That's what I was talking about. You're surrounded in a room of people, but you're not really there. You don't feel connected to them. You're just kind of detached. And it's like they tell you, oh, you're going to do this. Okay. Well, you're going to do that. Okay. It's like, you just see that there is just not really the connection between the person. They're just going through the motion, but they're just not connected to what's really happening. People get really jumpy. If we are driving that Park Avenue, my friend is kind of not doing well, so we don't drive there. She gets, her heart starts beating faster. She gets really anxious. Her hands are getting sweaty. She's just, whatever conversation we had, it just stops. People can get irritable. People can get, emotional outbursts. It's like, why are you angry? Well, it's the whole thing. And people can get very hypervigilant, really jumpy. And these symptoms, as I said, may happen during treatment or after the treatment is completed, or even, a few months or few years later. You just never really know how those kinds of traumatic experiences are going to affect you. It's really hard to predict. And each and every one of us deals with trauma and stress in our own way. So what makes it more likely that we are going to have more stressful reactions to cancer diagnosis or traumatic events too? It's not only, the symptoms are pertaining to other traumatic events in our lives. It's not only cancer. So, with cancer, the severity of our symptoms and the longer the treatment is going, we are going to be more likely to deal with the stress and emotional toll. We're more at risk, puts our more at risk. If with the kids, that depends, how they express themselves. Depending on their age, they will express their distress differently. So, you can't expect 5-year-olds to give you, unload their feelings onto you. They will not know how to talk. They don't have the emotional knowledge how to, and skills, the verbal skills to talk about their emotions. People start being able to talk more about their emotions when they start hitting teenage years. Their verbal skills and understanding it gets a little better. If people have more pre-existing conditions, they have pre-existing depression, pre-existing anxiety, they had other trauma events happening to in their lives, that puts them more at risk. But it's not 100%. If people have lack of support, that also makes it difficult. How do you, if you're not, if you go through chemotherapy and you have to drive your car because you don't have anybody to take you there, how are you going to get there? Or if you have to take public transportation, you don't have anybody to help you with, when you're not feeling well, nobody to hand you the glass of water or cup of tea. You're just kind of dealing with on your own. That increases the risk of emotional complications. And as I stated before, how we are dealing with stress and trauma really, really depends on how our loved ones are dealing with it. So if our family is not coping well with it, it's going to affect us. We don't live in a vacuum. We are, as much as you would like to think that we are individuals, we rely on other people for support, that being our siblings, our parents, our significant others, friends. It's everybody gets affected. If somebody gets sick, that's actually the case with any illness and any traumatic events. It's a whole system is affected, and everybody needs to get support. The other thing is that the more pain you have related to your treatments or your diagnosis, the more likely you may be to deal with this this can be more challenging for you to deal with it emotionally. So that's why when you are in a hospital or in a clinic and, these nurses are asking you, where's your pain today, 1 to 10? It's like, well, I don't know. Like they keep asking you every time anybody comes. This is an annoying question. Well, I don't know what a 10 is. I don't know what 5 is, like 1 to 10. That's why they're asking, because they know that if you are in a lot of pain, it's going to be more difficult for you to deal with it. And that's actually for any trauma at all. That being, there's other traumatic events that can happen to us and happen to us over our lifetimes. And if at any point we are in pain, that makes it harder for us to deal with things emotionally. So how can trauma and post-traumatic stress affect us? Let's subtract the kids. So we may experience emotional difficulties. We can be more anxious. We can be afraid. We can feel sadness. We can, with the sadness, if it's persistent, can evolve into depression. We can feel very angry. And we can feel guilty. It's difficult to deal with, and we can have all these emotions all at the same time. We are capable of having many emotions at one time. It's not only one, but, there might be one on the surface. A person may seem very angry, but they also may feel a great deal of sadness. That's actually a pretty common thing for kids. If they are super irritable, I usually think about depression. It's like, do they have depression? And it's, and like with anxiety or depression, anxiety and depression likes to travel together. So, if somebody is depressed, they usually have a fair amount of anxiety. For kids and for adults, people can be very irritated. They can be withdrawn. They start getting very defiant. For smaller kids, you may observe regression, like they may start sucking their thumb or curling in the corner, or depending that, that they may start bedwetting or demand that they are put back in the diaper, or, just behaving as a much younger child. And, adults can regress too. They may, like a 60, 50-year-old may turn out in a teenager all of a sudden, they want to do this and that. Like, I've never done this before and I'm doing it. I missed out. People can have sleep problems, nightmares, during the night, and as you're trying to fall asleep, or this may be difficult, and when you're and you can keep waking up throughout the night, too. It's that's a sign of distress. People can have trouble concentrating, so it's actually pretty observant in school when you deal with kids, because they're all of a sudden they're just not paying attention, and you have this kid that is in school and they were a good student, and all of a sudden they just can't pay attention. They're just not there. The same for adults. When you're at work, you're just starting to miss things. Maybe coming to work late, or that just things that they were at the tip of your finger, and then it's really hard for you to do your job, or take care of your household. Like you were the avid gardener, and by mid-May, your pots were there, and everything else was done in the garden, and you raked everything and whatever, and not interested. People can develop stomach aches and headaches. And also, as I mentioned before, when people are diagnosed with cancer, it affects the whole family. And there can be a lot of turmoil and conflict. We may think as a cancer survivor that we are dealing well with it, but our family may have a hard time dealing with it. And there's also financial considerations for it. And that also makes things more stressful for people. And how do we support our loved ones through this journey? So, creating a safe environment is really important. It really helps for kids and for adults to have a routine. Trying to really keep to your routine, so you wake up at the same time, you have your breakfast, you don't skip meals, even if you can't have it, just kind of trying to keep to your routines, not changing anything. And providing reassurance is really helpful. when people start talking about feelings, it's, we are not very good listeners. We are not good listeners. We don't really like to talk to people about their feelings. We don't like to talk about our feelings, and it's hard for us to hear other people talk about their feelings. And oftentimes when people start talking about their feelings, we move into a strategy mode. I think it might be important to think about, to ask them, do they really want to vent, just kind of hear them out, or they want to come into solutions? So that might be helpful, that may help to guide the conversation. But oftentimes when I talk to people about something, it's like, I just want to vent. It's like, no, I really don't want your advice. I want to talk about this and that and something else, and I really don't want you to think about what the solution is. I want to vent my frustration. So, art and leisurely activities, if you were into knitting, painting, just kind of relaxing, trying to take your mind off of things might be really helpful. So you keep with your artistic outlets. They're really helpful. The other thing is it's the information when we go to our appointments. When the fact is that when people go for medical appointments, the individual that has the diagnosis, in fact, any medical diagnosis, they remember about 30% what's being said in the room. So it's really important for us to, if we are dealing with such a significant diagnosis, to go with somebody that can be there for us, then can listen to more information and ask more questions, because we think we're going to remember everything. We won't. We will miss important questions, and they will they will ask the questions for them. And it's good to come prepared too with your questions, because you think that you want to ask the doctor this and that and something else, and you will remember it. But when you're actually in the appointment, you probably don't. So you may forget about things. So it's really important to come with your list and with a person that can field some of the questions for you. And it's, and as I said, modeling healthy coping. This is for families. So if somebody is ill and has, it's important for us as the relative or a significant other or a friend. It's modeling the healthy coping skills is really important. How we cope if our friends are dealing with difficulties, how we cope and support them will help them. So it's really important to think about it that way and seek help for ourselves too if we are having difficulties with it. And like we were talking about previously about exposures, limiting your exposures is really important too. So you don't have to unnecessarily drive wherever you need to drive or think about things that you don't want to. So there might be certain movies you really don't want to watch. It's okay. It's really important to spend as much time as de-stressing activities as possible. Going for a simple walk if you can, or sitting on your porch and enjoying the birds, or sitting outside, or doing a puzzle. Whatever brings you, gets your mind off of it and of your stress, and if you can do that, that's great. And it's really important during difficult times in our lives to maintain our relationships with people. All the relationships need nourishment. And we may not want to call people. We may want to cut off. People may ask questions, difficult questions, or curious questions, or just ignorant questions. But it's really important to keep maintaining our relationships with our families, with our friends, with our supports. They are there for us. So then next we are going to move when we need to seek professional help. So when our symptom, it's important to start thinking about needing help is when our symptoms start interfering with our lives. So we can't cope at work, our relationships are really struggling. There is a lot of anger, that we are not really getting along with our, parents, significant others, siblings, where there's a lot of yelling and screaming. you were having prolonged difficulty sleeping, that's the time to seek help. If symptoms last a few weeks to a few months, and they are the same, and the change in our, somebody in the previous session asked, like, well, how do you know when we need to seek professional help? It's when there's or for yourself or for your significant other, when there is a significant change in the behavior. They slept always very well, and they always went for walks or did whatever, and all of a sudden they are not sleeping, they're up all night, and they are not doing much of anything at all. For kids, it's, there's thoughts of harming themselves or other people. If we start having those thoughts, kids are a little bit different than adults, so for them it's more common, but there are adults who do it too. And any significant changes in behaviors that are concerning, it's important to start seeking help. It's just the person is not the person who they were. Let's say they were a stellar varsity sports athlete and they were a good student, and all of a sudden they are not going to school or bringing Fs, and they are really not going for practices and whatever. That's a significant change. And when people start feeling overwhelmed, you can start feeling overwhelmed by the diagnosis or the treatments that you're going through, or observing your loved one going through the treatment and getting the diagnosis. It's overwhelming, and it's okay to seek change, seek support. And the people include child psychiatrists, therapists, social workers. There's a lot of resources in a hospital that can be provided at the time of a diagnosis, but probably long-term you want to find somebody in the community that you can see long-term. I mentioned this briefly before. Witnessing, the diagnosis is difficult, but as caregivers, watching somebody going through these difficult times is difficult too, and it's traumatic actually. Seeing your loved one with in a hospital with all sorts of tubes and other things, it's really difficult to do. People may start feeling guilty. They can get anxious, overwhelmed, sadness. They may start also having the avoidance symptoms as well. They are driving this person to the hospital, and they all of a sudden have a problem with, I'm really getting uncomfortable driving in this area of town, although I was not diagnosed directly. It's really important to prioritize self-care, eating well, exercise I mentioned, and doing the activities you enjoyed. If you liked art shows or going, to the movies or whatever, try to really incorporate it into your routine as much as possible. Talking to your family, friends, supports, your spiritual leaders, and other people who have similar experience is really helpful. Group therapy can be actually very helpful too. My first, I was not just quite a doctor yet, and I came to the United States, and I had a friend of mine who was an amputee, and I went to a support group with her, and she was talking about whatever challenge she had at the time, and other people gave her, really awesome advice, whatever the issue she was dealing with. And I started thinking about a group about, I don't think any doctor would know this. This was a very practical thing that this friend of mine was dealing with, and I don't think any of, I'm a doctor now, I don't think I would know to tell her whatever she was dealing with. The other thing is, thinking about your resilience and your strengths. I mentioned resilience several times. So resilience is our ability to deal with stress and cope. And we are all resilient, but we are not resilient 100% of the time. And it's something that can come and go. We may be resilient, let's say, during our treatment, but then treatment ends and our resilience may disappear for a little bit. It's okay. That's what can happen. But we are all very resilient creatures, and we have all our strengths, and we need to build on our strengths. Reaching out to your supports is really helpful. Local and national organizations, they offer a lot of groups and family support. Mental health organizations, your primary care physicians may have good referrals for you. And when somebody is in a hospital, there is a lot of people who provide support. We're not superheroes. As much as you would like to, we rely on others, and life in general is a group exercise. So if you think about your superhero, and you're wearing the capes all the time, and you are super resilient, remember that the cape is not helpful because you can get sucked into the jet engine. So to summarize my talk, I hope it was helpful. Healing takes support and it takes time. And it's not a week, it's not 5 days, it's not 5 weeks, it can be years. You give yourself time. And you probably heard this cliche, new normal. It is a new normal. Remember the resilience of yourself, the resilience of your family and your relationships, and ask for help so you don't feel alone. It's actually interesting that you may be surrounded by people, but you feel alone in all of this. It's normal to feel that way, but that should be a sign that you need to seek help. Thank you.
Hi, I'm the patient, and I bet I'm not the only one in here who's also the mom, the wife, the sister, the aunt, and so, these people are supporting me, but I also have to support them because that's my life. That's why I am their friend and their mother and their wife. So, can you talk a little bit about balancing that? Because I do find that it is hard to balance. I want to be the one who takes care, not the one being taken care of.
Yeah, it's kind of interesting because I think that what I'm hearing from people is like oftentimes it falls for them to provide reassurance, and they are doing everything they can to fight this. But it's giving yourself grace and your family grace that they may not be coping as well as you would like them to. But there's also something that we call boundaries. And if I think it's, if somebody, like in your life in general, if somebody talks about something that you're really uncomfortable with or you find it particularly emotionally draining, I think it's okay to tell them, well, I think I'd like to talk about this another time. It sounds like you're having a hard time. I hate to give you clinical advice, but thinking kind of where your boundary is and what makes you uncomfortable about it. And if you're really uncomfortable, I think it's really okay to set up boundaries. We don't have to be everyone to everyone, like the superhero. You're just kind of like helping everyone. Your family. So what you're noticing is your family is having a hard time coping with it, and that's exactly what you're describing. And maybe they need to seek professional help to deal with their own understanding and coping, because you can't be their therapist.
We're going to go to an online question.
I was going to address the same question.
Great.
I'm a patient and a mom, and the flip side of your question is that when I was going through treatment, it was so important to me to hold on to my role as the caregiver of my little children when it was safe. And sometimes people wanted so hard to make life easy for me. Go, relax, lie down, watch TV, we'll take care of them. And it's like, please let me take care of my kids. So again, I have the caveat that we can want to do more than really is safe, and that's not a good thing.
Yeah.
But if it is safe, if it's not overtaxing, if it's not increasing risk, then respecting patients' roles, patient's ability to fulfill a role and need to fulfill a role, even if it's as caregiver, I think is healing.
I agree. This would speak to something that I was talking about, keeping the routines. Keep to your routine as much as possible. If you're a parent with cancer diagnosis and something you do for your kids is making them pancakes or whatever you're doing for breakfast, if that's your thing, just try to stick with your routines as much as possible. And because it really helps, the routine helps our agency and our sense of accomplishment. So it's a very difficult diagnosis, and it's a life-changing, but keeping to as much as possible to whatever you were doing before, it's going to be really helpful and healing, because you continue with the mastery of the tasks of your life to the best of your ability, and one of those things is taking care of your children to the extent you can.
We'll have 2 more questions here before we go to a break, but Dr. Litak will be here for a few minutes after to answer some questions. So I'm going to come right here, and then I'll come over to you.
Hi, my name is Angela, and I'm a patient as well. Talking about, if you do need help, you need psychiatric help, counseling, support groups, all kinds of stuff. How on earth do you find the right help? How do you find a good psychiatrist? How do you find a good counselor, psychologist? How do you find the right people to provide trauma work, who specialize, who know about cancer and chronic illness? And I have been so overwhelmed trying to figure out a lot of this stuff by myself. And luckily, I have a wonderful therapist. But I know there are shortages. What do we do in this situation? And it just gets to be too much to try to figure this out on your own. And I'm finding that in my healthcare systems, also a lack of help with resources. Kind of, here are the resources, go look at the websites, and there you go. And it's so important to get the help you need. And with my psychologist, meeting with her 1 hour a week, that is not enough. Mm-hmm. Luckily, I've found a wonderful support group called Rain in Sarcoma, and that's been saving my life since I was diagnosed. And it's just, when you're the patient and you're trying to recover and you're trying to deal with anxiety, depression, work, your normal life, how do you get the help that you really need?
Well, that's a question. That's a very difficult question. And in general, even if you don't have the diagnosis, that difficult diagnosis, it's hard to find mental health and find help that works for you. We are not all fit to all people. I'm not a psychiatrist for everyone. I will admit that. Not every therapist will do well with every patient, and certainly it helps if the person has experience dealing with particular illness you have. But it is a big challenge, and that's where perhaps your family practitioner can be helpful. They usually work with somebody, they can have resources. Maybe this psychologist you're working with, they have ideas about additional resources, or the clinic where you go for treatment, they also may have, information about additional, support. But it's a challenge. It's a challenge. And I have to admit, I am a doctor, and it's been a challenge for me, for members of my family, finding the help that I needed. And I thought I found the help that I needed, but it was not the help that I was needed, actually. So it was, a couple of years later where I found the right person, but it was kind of too late, actually. So, it's really frustrating, and it's very difficult. But, I would ask all your friends, anybody that you can. And sometimes you just see a person. I would advise, if you are looking for a therapist, see that person 5 times. Give them a chance. Because, when you see somebody and you don't like them off the bat, well, maybe maybe there is something. But if you see them 5 times, it's like, you will really try it at that point. You really try to give them a chance and it's not working out, then you need to seek somebody else.
I had a general question. I'm a patient. I'm 44 years old. Well, take that back. I turned 44 this year. My mom is 75, and she is really struggling with having a child who has cancer. For a little bit of context, my dad, her husband, died of cancer in 2019. So do you have any advice, general advice, for helping a parent of an adult navigate?
Well, that's where I think that if your mom would agree, which she may not, to seek help for herself, because there's a lot of issues. There's also something called grief and bereavement. Like if we lose somebody, it's a process. It's a long process to grieve, and understanding that it's really important. And I think if your mom is having a hard time, perhaps would be something that she would consider.
Sharon's going to read an online comment really quickly.
Yeah, I just wanted to share that there was somebody on the group chat online that said Gilda's House is a resource and a group that can provide some support for cancer survivors and current cancer patients.
Thank you. Thank you, Dr. Litak. Thank you, everyone.